Hi, everybody. My name is Robert Beauchamp. I work for Cinca Dental, and today we're going to be reviewing one of the products that we sell called the Optiview 2 intraoral camera. This camera came out this year. It is the second generation of Optiview, and I'm very proud to bring it to the market because it is a leading technology. What I'd like to do is kind of review with you a little bit some of the key features of the product through a little presentation that I've created. So what I'm going to do now is I'll just share my screen and share with you some information on the camera. When it comes to the intraoral camera, I do firmly believe that it is one of the most powerful tools you can integrate into your practice. Really, when it comes to sharing images with patients, it is true what they say about seeing is believing. So how are you going to use imaging in your practice on a day-to-day basis? Well, one, you need to really show the patient through their own eyes the problem. They have to see what you're talking about. They have to see the fractures, the open margins, the decay. It's basically providing trust with proof. You can really communicate most effectively when you're showing them, x-rays with problems and intraoral camera images of the tooth side by side. So they get the inside and the outside perspective of the situation. You can magnify certain issues or concerns and clarify the problem and the urgency of treatment to address the preliminary step in getting something done or a treatment accepted is really understanding and seeing the need for treatment and the problem. You have to gain the comfort, credibility, and trust as fast as possible, and nothing allows you to do that better than backing up everything you say with a picture. Show images of every stage of the communication and educational process, the problem, the treatment options, and the possible results. So trust with proof, no gray areas, no lack of communication based on digital means. This is where really you're just basically talking and showing. You're not having to try to explain through some type of a flyer, a chart, a model, or whatever. You can really just show them exactly the situation and what you mean. The other thing that's very important is that you start to utilize multiple sources of information. So you want to get your staff to start using the camera, get them to start documenting the information, the concerns, the areas, the need for treatment. And then you come in and reiterate as the doctor, just to, again, get multiple people saying the same thing. And this will, again, tap into that comfort and trust when you can show them images of the problem through a hygienist. And then you come in and revisit and say the exact same thing that the hygienist said in regards to treatment option. And then showing images of patients that have accepted this treatment that you've worked on and showing the quality of your work. This is going to be an important element that taps into the psychology of treatment acceptance. Really expedite and improve comprehension and enrollment by the use of images. They will understand faster. They will move forward faster. They will, really understand what you're talking about. And if they see the problem, they will accept solutions. If they don't, they won't. So images do speak louder than words. And you have to communicate in the most effective way possible, which is through images. We know that 83% of our information comes in through our eyes, and that words and pictures together increase comprehension by 6 times. So this is really where you can get patients to comprehend and move forward with treatments. Okay, when we look at intraoral cameras versus, let's say, handheld digital cameras, the benefits of the intraoral camera is that they're very easy and fast to use. You can pick them up, go in the mouth, take a picture, and pretty much 30 seconds, you can start acquiring images and save them in the patient's file. So the images are instant, they're downloaded, they're saved, and they're recorded in the patient's file. So that's something that is very easy to use and do. You have multiple surface images. So you can take, lingual, buccal, distal, mesial. You can get all kinds of different angles to really show fractures. It works like a transillumination device, which is important. You can get much closer magnification live. So if you want to use the camera as a diagnostic tool, you can. If you want to use it as a microscope and start looking for the MB2 canals, you do have this ability to just pick it up, go in the mouth, and start looking or evaluating your margins on crowns, etc. So it's a great tool for that. powerful and important application to integrate would be code discovery and code diagnosis. So this is where, the team, the staff partners with the patient and does a live tour of the mouth while visualizing on a screen their oral cavity. So you partner with the patient to show them their teeth, to expose them to the lingual side of their teeth for the first time, so they can understand and see the situation when they're in your practice. And it does integrate easily into a systematic routine. So these are the benefits of an intraoral camera versus, like, say, a handheld SLR camera from Sony or Canon, etc. Some of the disadvantages, though, of the camera is, even though they can take full face shots, some models, my model can, it's good enough to get a full face shot in the practice management if you just want them to know, okay, this is Robert Beauchamp coming in, so you can have an idea of what they look like. But it's not going to give you a very crisp full face shot. So if you wanted to get into imaging and cosmetic simulation and whitening, you can't use these images for that. You really need to buy a handheld SLR. Same for smile and art shots. If you want high detail, you have to go with those cameras, those SLR cameras. You can take arch and smile shots if you just want to document with the intraoral camera, which I'll show you, but really not the best image quality. If you want top-notch quality, you have to go with a handheld SLR. The intraoral camera is more expensive than the handheld SLR for sure, but it is much more versatile for the day in, day out needs of communication with patients for treatments for restorative and commercial. And of course, handheld cameras you can use for personal use, like your digital cameras you can take on vacation. Intraoral cameras you cannot, or maybe you do, I don't know, but no. For the intraoral camera, the goal really, this is a quote from a very well-known dentist in the US. This is from Dr. David S. Hornbrook. He's a leading cosmetic dentist in California. So an absolute must is the intraoral camera. Not only does it aid in diagnosis and case acceptance, it also allows the patient to fully comprehend and understand the need for treatment. It is not until they truly understand that they can feel comfortable about accepting treatment. It is the complete understanding that creates value and trust. So this is what I've been alluring to in terms of using images, okay? That's what you want to do. When you look at the reviews and the articles and the surveys done, most dentists are buying intraoral cameras to improve patient education, case presentation on restorative procedures, case presentation on cosmetic procedures, and really insurance approvals. It helps to have a picture along with an x-ray to get them to send the coverage for the treatments. There's also other elements that they found important in terms of building your practice through word of mouth, enhanced diagnostic capabilities, treatment planning, managing operative procedures, image storage capability, hands-on demo and trial use. And of course, if the college recommended it, which I think most people do recommend the use of the intraoral camera now in dental practices. When you're choosing a camera, what are the criteria you want to look for? Definitely, you want to get something with automatic focus. You want something that's easy to use, that can take that full face shot, that can take a full smile shot, that can go in and take some teeth, go in and focus in on an open margin and a fracture without needing to focus anything. You want something super simple for staff to use so that they start to use it. You want one lens that can do it all. The less needs to change the lenses or modify things, the less likely it will get done. So get a uni lens design that can do it all. You want macro lens capability. What that means is you want a camera that can really zoom in and show the fractures, the open margins, the underlying shadowing, really to hit home the concern and the need for treatment. You want to be able to get that detail. You want a crisp image every time. You want to make sure that when you take that picture, it's a nice sharp image to show what you need to show, and also that the capture speed is elevated so that you can make sure that it's not blurry, so that you don't have to waste time retaking. You also want a well-balanced handpiece that allows for easy manipulation intraorally for the staff, so that again, it motivates usage. Today, we're going to be talking about the Cadi Optiview 2. This is a product that we had made based on our demands, and really has the ultimate combination of elements to create an amazing camera. So full true autofocus. You even have the option to put it on a push focus option if you prefer to have on-demand focus, or the full time. It takes I guess, a fraction of a second to focus on the object when you're moving from different distances in the mouth. It has a full HD 1080 resolution, which the images are incredible. Really surprised with the image quality. Digital image stabilization firmware. So again, always still images, no need for the retake. A full aluminum encased shell housing, which is great for the day in, day out, you know, hustle and bustle that, you know, these staff go through. You know that you don't have plastic, you have aluminum metal that will definitely stand the test of time. You have a direct USB option, and there's also a wireless option, which again, there are certain compromises with a wireless solution that if you'd like more information on, you can definitely send me some questions and ask for more information, and I'll elaborate on why I do still feel that a direct wired solution is the way to go. And we have a 90 times zoom magnification and a 2-year warranty on this product. The Optiview dual intraoral camera, the image quality is really unparalleled. You can even see the detail in the image right here. You can see the marks on the enamel. You can see the adjustments on the incisal edge. You can really see the quality of the image. It's even more impressive in person. It does have the highest quality internal components with a 16-bit output, Sony CMOS chip, internal infrared system with natural white spectrum LEDs, fog-free lens, really unparalleled diagnostic clarity. We've also programmed the Optiview 2 to work within the Cadi software platform to be fully automated as well. So when we are capturing teeth by tooth number, you can navigate through the mount of images just with a button. So if you know, we do train people to start on the upper right quad, so basically the tooth number 1 or 18, and you advance through to the second quad, then down third and fourth. And we've designed the mount to work this way, and we've designed the buttons to advance through tooth numbers automatically. And then you can capture with the other button, you know, capturing multiple images of the tooth, being able to show the different surfaces and different areas of concern and document them automatically. So no post-acquisition tooth numbering, tooth labeling, tooth dragging, dropping. All this is fully automated in the acquisition of the software. Again, making it simpler, easier, and faster to acquire the images and then use them for patient communication, education, and case presentations. So really, in summary, the Optiview 2 is an amazing camera, great communication tool, incredible diagnostic tool, easiest and fastest for the staff to use, fully automated within the Cadi software, and really gets the most out of your imaging needs. You know, we all know that images are a better way of working and communicating. It's really finding the right solutions that allow it to be easy for staff to get the pictures and then easy for them to present these images. You know, when you look at a camera investment, you're looking at usually a quality camera will last over 10 years. In fact, we had cameras that we've sold in the late 90s that are still around, and people are still benefiting from the visual communication of these tools. There is nothing, I think, more important than being able to introduce patients to their teeth visually by anatomically charting the teeth visually, being able to show patients exactly what you're talking about. And it just takes the onus off of the dentist or hygienist or dental staff to be able to communicate what they're seeing and what are the issues. It's so much easier when you start using pictures. And the goal is really to find the right combination of camera software to make it easy for staff to do this day in, day out in order to reap the benefits of this improved communication, especially with this ever visual society that we live in, where we are ingesting most of our information visually and comprehending 6 times quicker with pictures and words together. So I want to thank you very much for your time and on this product. Hope you give the opportunity for the Sinclair staff to be able to see the camera and try it out. I really think it's something that will be beneficial, And you'll, if you do take the time to integrate it into your practice and into your day-to-day routine, new patient, recall patient, emergency patient, restorative, cosmetic, you can really endo, crown bridge. It's unbelievable how you can use these visual aids and how it can benefit you day in, day out. And then how it can tap into the psychology of the decision-making process, the trust, the comfort, the comprehension, and the acceptance of treatments. It will have a huge impact. So I definitely challenge you to try it, buy it, use it, and you'll see this combination, this best in breed of camera with software will definitely pay the dividends, and your return on investment will be worthwhile. So thank you again for your time. Appreciate it, and hope to hear from you soon. Take care of yourself. Until the next video. Bye-bye.